We are still covering everything in the respiratory system of normal. We haven't really got into any of the abnormal breathing patterns, so on and so forth. So, like I said in the earlier videos that you've already watched, looking at what's normal versus abnormal, we have to understand what's normal. So, normal breathing signs, we should see regular rhythm and depth. An average person breathes between 10 to 12 breaths per minute. For the adult, it's usually 12 to 20. Anything below 10 is said to be bradypnea, meaning slow breathing. Anything above 20 is said to be tachypnea, which is fast breathing. You should have clear, equal breath sounds on both sides, the right and the left side. So when you listen to the front of the chest, the back of the chest, and on the sides of the chest, they should be smooth abdominal wall movement. Nothing should be exaggerated. They should be equal rise and fall of the chest on both sides. There should not be what they call paradoxal motion. And that's usually what happens with somebody who has a flailed segment. And we will talk about that as we get into the trauma chapters. And understanding what's normal now is going to help you when we move into the more complex and complicated subjects of the pathophysiology associated with medical and trauma patients. Signs of inadequate breathing. We'll take a look at this young lady here, and you notice we talked about accessory muscles, right? Here's you some signs of inadequate breathing. See the accessory muscle use, right? So she's tachypnic. She's breathing more than 20 times a minute. She has those neck muscles working. You see she's doing the head bobbing, so on and so forth. A lot of times these individuals will have pale or bluish color skin. It's called cyanosis. This is a late sign. Cyanosis is a late sign in individuals. They will have cool, moist skin, meaning they're cool, clammy, and diaphoretic. They're tripoding. A lot of times they're leaning forward, and it helps to aid in their breathing. But like I had said before, these individuals usually should be breathing 12 to 20 times a minute with good rise and fall of the chest, meaning they have good tidal volume and they have good minute volume. So looking at this young lady, you can tell, and we'll go back here again, we can tell that her tidal volume is decreased. How do we know that? Look at her accessory muscle use. She's having to use the muscles in her neck, the muscles in her pecs, the muscles in her intercostal space. She's using her diaphragm. She's having to pull up and outward to generate that negative interthoracic pressure. This is all a bad sign. This is usually a real bad asthma attack. And a lot of times they'll need ALS intervention. But if you're just an EMT crew and you're out there, you're going to have to do a non-rebreather, 15 liters a minute, and you're going to have to rush her to the hospital because time is of the essence. We have to correct this, right? Right. So let's move on into the next videos. Summing it all up, the respiratory system maintains life through oxygen delivery and CO2 removal. Guys, this is, like I said earlier, this is the bare bones. This is the essence of the respiratory system, the anatomy, the physiology, is it maintains life through oxygen delivery, meaning that gas exchange happening in the alveoli to getting the oxygen in, the CO2 out. Proper function depends on airway anatomy, right? Because some people can have anatomy that's affected. Well, how can they have it affected? What about these individuals that are in real bad car wrecks and they don't have their seatbelt on and their chest hits the stern wheel and they break 3 or 4 ribs? Or what if they go through the windshield and on the way out, their trachea, their windpipe encountered the stern wheel on the way out, or they hit the dashboard, right? And maybe you have a small 8 or 9-year-old child sitting up front and you've had a head-on collision and that child's trachea has hit the dashboard. These things can be affected. The anatomy can be affected. The mechanics can be affected, right? So that rise and fall of the chest may not happen as it should. And remember, I had spoken to you earlier about individuals having head injuries where they have hemorrhagic bleeds, where their vessel has ruptured in the head due to trauma. and you have neural control issues. So the medulla and the pons won't work together. And that very complex, that really neurological area in the brain that controls the respiratory system, the medulla oblongata and the pons, they're working together to increase inhalation, exhalation, the depth, the rhythm, so on and so forth. And remember, the pons is fine tuning how well an individual is taking their breaths in and out and how much air we're moving in and out. And you got to remember the medulla and the pons are monitoring levels of CO2 to maintain adequate pH levels and getting the CO2 out and the O2 in. And so the proper function, it does depend how well the anatomy is put together. Is there any damage to the anatomy? Is the physiology, the lung mechanics, is something going on there? Neurologically, is something going on as well? And even if the mechanics are okay and the anatomy's okay, what if somebody has a fentanyl overdose? That affects the medulla and the pons because it's a central nervous system depressant. So that's something that's not even really trauma related or really medical related. That is a narcotic where a person is taking too much and now they've lost their respiratory drive, their respiratory centers are knocked out. And we will have to get a bag valve mask, a lot of times with a nasal pharyngeal airway, and we will have to breathe for these individuals until we can get a medication called Narcan on board to get rid of it so that we have adequate rise and fall of the chest, so that we have adequate minute volume, so that we have adequate ventilatory space being ventilated, right? So we can get that 500 mLs in, 500 out, so we can get oxygen in and CO2 out. And recognizing normal versus abnormal breathing is vital in emergency care. It's 100% vital. And if you don't understand it, then you're going to have to go back, read the book, follow me on TikTok, get on a Zoom call, live 101 with me, whatever we got to do. We'll do it in a group. It doesn't matter. But you have to understand the anatomy, the physiology, the lung mechanics, the neurosystem going along with it, and knowing how gas exchange works in the respiratory system, because we're getting ready to get into the cardiac system, the cardiology and the circulatory system, and how it articulates with the respiratory system. And you have to have both pieces of the puzzle to really make a fundamental difference in saving these individuals' lives. So we look at the human gas exchange, the lungs, we get air in, we all the way down to the alveoli. So we see the O2's in, the CO2's out. The respiratory system, quick recap, we have the nasal cavity, what we call the nasal pharynx. We have the oral pharynx. We have the epiglottis. The epiglottis is responsible for not letting what? Any food or fluids make its way into our trachea. Our larynx is known as our voice box, and the larynx is what separates the lower and upper airway from one another. Test question. The trachea, better known as our windpipe, comes on down and it branches into the right and left side at the carina, the fork in the road, correct? And once it starts to go into the right and left side, there's where we have the bronchi. The bronchi make their way on down, becoming the bronchioles, and the bronchioles become very small, making their way on down to the alveoli. And everything before you get to the alveoli is nothing but dead space. On average, it's 150 milliliters. And we know that these lungs, in order to expand and contract, are covered with what? Visceral pleura, and the thoracic cavity is covered with parietal pleura. And the parietal pleura and the visceral pleura have a fluid in between them so that they can move independently of one another, and so they do not cause a pleural friction rub. And the diaphragm is the primary muscle that is responsible for inhalation, exhalation, and the accessory muscles are in the neck, the thoracic cavity, such as the intercostal space and the pectoral muscles, so on and so forth. And now looking over to the right side, this is the capillary level. This is the capillary level. These are the smallest blood vessels in the body. These capillaries cover the alveoli. They cover the alveoli, and here's where diffusion takes over. So we know that the oxygen molecules that are in the alveoli make their way from that space into the vascular space where they come in contact with red blood cells who have hemoglobin. Hemoglobin has a high affinity and attraction for the O2 molecule, and it makes oxyhemoglobin, and CO2 makes its way from the vascular space into what? Into the alveoli to be exhaled. Now, guys, that's going to wrap it up for that right there for the respiratory system. That is the normal anatomy and physiology of what? Of the respiratory system itself. I have another series of videos coming out on pathophysiology. If you don't know what pathophysiology is, it is the disease process, the study of the disease process that takes place in the pulmonary system, because we're going to look at COPD patients, emphysema. We're going to look at bronchitis patients. We're going to look at asthmatic patients. We're going to look at patients in anaphylactic reactions. We're going to look at patients with all kind of different respiratory issues, whether it's a flailed segment, whether it is a pneumothorax, tension pneumothorax, hemopneumothorax, simple pneumothorax. We're going to look at angioedema. We're going to look at epiglottitis. We're going to look at a lot of different disease processes that affects the individual that may be having respiratory insufficiency. So if you don't get what you need from this video, you need to reach out to me and say, hey, Jeff, I need more help. I need understanding. I need clarification. And let me help you, because this is the core fundamental building blocks. You have to understand this and have complete comprehension in order to make a decision of how you're going to move forward and take care of your patients. Because moving forward, if you don't understand this, when you get into the neuro system and you get into the cardiovascular system, the circulatory system, and we get into the renal system, this stuff all connects. You will not be doing well in your EMT program if you do not understand this at all. So guys, let me know if you need more help, and I will be making another effort to reach out to you and see if you guys are interested in getting the pathophysiology system that comes with the respiratory system.